Hello, I'm Dr. Laura Fenimore, and I'm very pleased today to have the opportunity to speak with Josh Palmer, who is a psychiatric nurse practitioner and an assistant professor at the University of Pittsburgh, where he teaches both undergraduate and graduate students about care of individuals with mental health issues and concerns. And so we're just delighted to have you with us today, Josh, as we continue to explore advanced practice roles in nursing. And so let's begin by having you tell us a little bit about your current roles and your scope of practice in those roles.
Sure. I'm currently working as a psychiatric mental health nurse practitioner. My role is to diagnose and to treat individuals who are living with psychiatric illnesses. We meet individuals, we learn about them, and we begin to see how we can treat individuals and help them to obtain the most out of their lives while having and living with their illness. And, we do that more in several different ways, just with either therapy, there's different modalities of that, as well as pharmacological management as well. And, we do a lot of education, and my scope of practice for my degree and license is from birth to grave. I actually have the license to work with pediatrics and adults, as well as geriatrics.
And do you work in a hospital or in an ambulatory setting?
I primarily do work in an outpatient clinic. Most individuals, we are allowed to work in a multitude of different areas, including inpatient hospitals, if we do care. There's also crisis centers as well, but I primarily work in outpatient, where I see individuals living in the community.
Mm-hmm. And do you work with primarily individuals and family members, or do you work with groups?
My role is for the individual. There are roles that do have more of a family-oriented style. I am trained in family therapy, as well as group therapy for individuals who share similar diagnoses. But me, myself, I do work with individuals, but that does not mean I only work with the individual. We don't really live in a world where we're a singular entity. So I always include family. It's never not part of the treatment to discuss the person as if they don't exist in our social world. So I do feel that even though I'm individual, like we're quite expansive.
So tell us a little bit about your journey in nursing and how you came to be a psychiatric nurse practitioner.
Sure. It all started basically actually in high school. I worked a lot in our state hospital. I didn't work, but I did a lot of volunteer work in our Torrance State Hospital, which is pretty much like the most intense level of inpatient hospitalization for individuals with serious persistent mental illness. And then I wanted to go into the clinical role. I got my bachelor's in psychology and did case management for individuals with serious mental illness. I worked on a task force called Assertive Community Treatment, and that's where I met my first psych nurse. And I had decided that I wanted more out of my career, and I wanted to know more as well. I wanted to be able to provide something extra. So my choices were to become a therapist, and that was a quality route as well. But the nurse that I worked with on the team was such a spectacular person. She had skills that covered the entire entity of a person, not just their mental health, but she knew how to help them medically, how to help them psychiatrically, and her communication ability with the patients was just so amazing to me. So I decided to go become a nurse. And that's how I was actually going to extend my education. So I actually backed up and got a associate degree in nursing from a community college. And from day one, I was a psych nurse. I had so much experience in psych, and I couldn't imagine doing anything else. But I began to really appreciate that I knew more than psych. I could really help someone with their psychiatric treatment, as well as be the advocate for them medically and help them as a person. And so then I continued to progress and got my bachelor's and then my doctorate, which I further specialized into the nurse practitioner role.
Mm-hmm. It's so interesting to hear you talk about one person having a really significant impact on your career. And I had those people in my career as well, and have had a chance to say thanks. I hope you've had that opportunity.
Sure. I still am well in contact with the individuals 12 years later. The things I was concerned about being a nurse, because I was very psych oriented. I had no knowledge of the medical care, and that kind of was intimidating to me. But they kind of alleviated my concern and encouraged me, reinforced the quality work I was already doing. And absolutely, I'm very glad. And the concerns that I had were a minor challenge whenever it, came down to it. I actually absolutely loved learning everything that I did.
Well, speaking of learning, how did you choose Pitt for your doctoral studies?
I'm a Pitt guy right off the bat. I got my bachelor's in psych at Pitt in 2003. So it was a very easy choice for me. The time that I got my bachelor's in psych was an excellent time. The school was fantastic. And when it came time, I had a lot of options to get my nursing bachelor's as well as progress in 10B. There's a lot of options out there. And at that time, I actually was living 3 hours away from Pitt. So I didn't want to go anywhere else. I had already proven to myself how much I liked the school, the campus, and the perception of students that the school had. So we packed up and came back to Pittsburgh to allow me to come back to the school.
Well, we're very glad you did.
Thank you.
We're lucky to have you here. Tell me a little bit about your scholarly project that you did as a part of your DNP program.
My scholarly project was a program evaluation where we evaluated how well a local buprenorphine, which is Suboxone, program had been helping individuals living with opioid use disorder. I utilized research that was already part of our knowledge set of Suboxone, and as well as expectations from regulatory agencies like SAMHSA or our local mental health agencies. And we made a pretty well-rounded evaluation of a local Suboxone program and how well they've done in the last 20 years. They were one of the first ones to open their services whenever this was a new treatment. So we really, I began to look over 18 years worth of charts to see what we did well, what we didn't do well, as well as changes that really benefit the patient. And everything that we evaluated had a basis in research. So we utilized knowledge, we translated that into something useful that we could see how well the project, the Suboxone program would be doing for their patients. We completed that, and using research again, we were able to make recommendations as well as reinforce things that we were already doing. And we also made a manuscript, and we're publishing that result in hopes that it helps other people evaluate their Suboxone programs.
Good for you. I can't imagine evaluating 18 years of chart reviews. My goodness.
Yeah.
Ambitious.
The idea of Suboxone treatment has evolved from 2000, so there were a lot of changes, and keeping consistent in our data gathering was a challenge.
What actually changed in the practice because you did this project?
We actually were identifying a lot of protective factors, things for why the patients had done so well. And we saw that in the earlier years of the treatment, evaluating like urine testing for illicit substance was just randomly done. It was based on provider expertise, which was good. He actually showed that he had a high quality of expertise. But whenever we had changed the protocol to where everyone is consistently tested, no randomization, we found that it actually promoted recovery in all of the patients. And the caseload, which had a consistent opening and closing as patients came and left, significantly solidified, and a lot of people started to obtain a lot longer level of recovery. So yeah, we found that to be one of the larger things in the evaluation. So we continued to promote that. This is something that we had to do. And just by luck, whenever COVID hit, a lot of the labs closed in the area.
Right.
So we became immediately concerned that we had lost a very important protective factor for a lot of people because they weren't able to go to get their labs tested that every month. So that kind of led our treatment as well. And then I guess the secondary thing we found was most people had cravings for opioids, and they were related to their physical pain, chronic pain. So we altered that. Our assessments included a pretty extensive pain assessment as a risk factor for relapse. So we started to incorporate that into our monthly assessments.
Fascinating. And we could talk all afternoon, I suspect, about this topic.
Whenever you delve into something for so long for my project, I could talk for days. I had learned so much from doing it.
That sounds great. In your role as a psychiatric nurse practitioner, what's a typical day look like for you when you're in your faculty practice?
Whenever my typical day, I go in. Now I do form quality relationships with my patients, so I tend to know them pretty well. But I get up and I kind of look at my last note for the patient. I start to formulate what our plan was the last time we met, identify assessment areas that I wanted to focus in on for our next visit, if there was an issue or a med change that I had made, and also some topics for follow-up, how they're doing with their psychosocial atmosphere, if they have like a lot of stressors, to follow up on that, as well as to plan my next step in their treatment. If we knew we were working towards increasing a med further, titrating to something else, and generally have something so that whenever I meet with the patient, I'm ready and I'm informed on what I need to do. So I'm not doing things kind of off the cuff, so to speak, when I'm with the patient. And then I start meeting with the patients. I can see between 16 to 20 patients per day, or if I'm opening new patients, that'll be a little bit lower, as I spend an hour with the patient when I first meeting them, doing a full comprehensive eval. And afterwards, I try to document. Well, I don't try. I do document everything, paying a lot of attention to what our future plans are, so that I have something to review next time I meet with them, as well as formulate any other treatments. I work with a collaborating psychiatrist, so I also discuss with him any of his opinions on some cases, particularly if they're complex and I made a lot of changes. Because we in PA, we do collaborate with a psychiatrist, but I think for me, it goes beyond that. I want to make sure that we are working as a team and that we're all sharing, because it comes back to me as well. When the psychiatrist is kind of stumped, he'll throw topics off of me, and so it's a team for sure.
Yeah. So how long have you been a nurse practitioner in psychiatric care?
I've been a nurse practitioner since got my license in June. And so yeah, I've been seeing patients since June as a nurse practitioner.
Okay. And so in those couple of months that have happened since then, is there a particular patient situation that stands out in your mind where you really feel like I made a difference?
Sure. I think what I try to do most of all is try to really perceive the patient and more than just their psychiatric illness, and see what's going on. I had a patient that had suffered from fibromyalgia as well as depression, not feeling well at all. And so I spent extra time. And as I started to really review a lot of the psychiatric issues as well as the medical issues she was having, we kind of came upon a pretty significant sphere of more than just fibromyalgia. There was a lot of chronic pain going on. And I don't want to go into too many patient details, but there was an indication. She identified randomly, just talking to me, a very small medical condition that she had that kind of set off a flag for me. Oh, there's a medicine that's not too commonly used, unless for this particularly small instance, that could have wider implications for her. And despite years and years of treatment trying to get on top of these symptoms, I went for it. I provided her with a education, everything that she needed to know on the medicine. And within the next month, she actually felt fantastic for the first time in a very long time. And, I was very happy for her, as we do as a nurse. We like to see our patients, but I also took some for myself and was so happy that I was able to perceive wow, this is great, and solved a lot of issues. It just kind of fell like a domino, and she became amazingly more functional.
Wow.
So I was proud of myself as well as proud of her for doing that.
And you should be.
Yeah,
absolutely. We talk with our first year students about what's it like to think as a nurse and to use critical thinking skills and your clinical judgment skills. And I think your example is really perfect to illustrate how thinking can really make a difference for.
Sure. And I don't think you have to be an NP, a doctorate to have that impact at all.
Right.
Yeah, that was something I did as an NP, but there were plenty of times as an RN where my critical thinking skills and knowledge of patients made a significant difference in their life. Yeah.
And now you're going to be teaching psychiatric nursing.
Sure.
Tell us a little bit about why that choice and how you balance your practice with your teaching responsibilities.
Yeah, it's an amazing turn of events for me. I was a teaching assistant during my graduate education, and I did it because there was a lot of need for me financially to help support myself during grad school. And I was terrified. I was petrified. I had the knowledge to share, but it was a scary proposition for me to be a teacher after being a student for so long. And I told myself, just do it. And, there's benefits for it. But as I continued to do it, I absolutely enjoyed being able to talk to people and share what I knew, and then have kind of inspire others to take enjoyment in, as well as enjoy knowing things. I like to share nurses know things. We do. Every level of nurse knows things, and it's a nice feeling to be in that position. And I think a lot of the students that I taught continued to inspire me, as well as increase my enjoyment of teaching whenever they started to integrate information and kind of shared the things that I liked about nursing. So I completely turned 180 and decided I actually wanted to continue to teach and share that. And that's what I continued to do. Cool. And that really hasn't changed. Every semester there's just a new group of people that enjoy this, and even if they're not interested in psychiatry like I am, I tend to have people at the end of the semester talk to me a little bit more about it than whenever they were at the beginning. Sure. And scared and wanted nothing to do with it.
Well, and the reality is that every nurse encounters mental and physical health needs for every patient that we are with, and whether they have serious mental illness or not. They may have coexisting diagnoses that may or may not be treated well. And so understanding the needs of our emotional health is so very important for every nurse, and which is why it's in the program, right?
Sure. And my patients go to the hospital
Yes,
just
indeed
the
they
same
do.
as anyone else. And unfortunately, my patients, they don't sometimes get the best care.
Mm-hmm.
And on the patient side, if I can have a student be a lot more comfortable with my patient, then I know when they take care of my patient as the ICU nurse, as the
Mm-hmm.
OB nurse, as my patients have children, anything, they're going
Mm-hmm.
to have better care because the students are a lot more comfortable, they're a lot more knowledgeable, and the stigma and mystique
Mm-hmm.
of mental illness, doesn't impact them as much as anyone else. And hopefully that translates and they'll be able to help my patients out better.
That's great.
Yeah.
Well, as we wrap up this conversation, I wondered if you could offer some advice to a student who's thinking about pursuing a career in psychiatric nursing, and specifically as a psychiatric nurse practitioner. What advice would you give for them, Josh?
I think experience is a key. Whether you're getting that experience working alongside while you go to work, while you go to school, the experience for Psych NP is really key. I think you have to really know yourself, and if you enjoy working with the population,
Mm-hmm.
people as nurses, we know things, and I'm confident as nurses, we can work with the information and help those individuals. But the willingness and the comfortability with working with my population is pretty key. And I think if anyone's ever unhappy, it might be just the shock of some of the behaviors and some of the situations that can occur with the
Mm-hmm.
psychiatric population. And I've noticed as people work with the population, they decide whether they like it or they don't like it. And
Mm-hmm.
as a psych NP, I think having your own perspective, if you enjoy the population, would be pretty important
Mm-hmm.
to really figure out about yourself. It's a very profitable and very wanted uh, nurse practitioner specialty. So
Mm-hmm.
having that, you'll have no problem. But to have a lot of satisfaction in what you do, I think meeting and knowing and working with individuals would be pretty important, even if it's something you do alongside your education.
I agree. There are real shortages in terms of psych mental health providers
Yeah,
who to meet the emerging needs of people throughout our country. And certainly in a time of the pandemic, those needs have really exacerbated as people
absolutely.
have
Yeah.
not been able to access their normal providers.
Yeah, there will be no issue for as if people need you or not. You
It's true.
as a psych NP, you will be needed. Um, but just like I think that's not an advice. That's not advice for just psychiatric NPs. I mean, you are going to be specializing as a nurse practitioner. This is going
Mhm.
to be what you do and hopefully what you love. And so, like the experience and just working with the patient population, I feel is pretty important. As well as you'll have a lot of exposure in the pharmacology, and pharmacology is pretty key, particularly with serious mental illness,
Mhm.
and having the knowledge and experience with the medicines that we use is a huge boon, particularly whenever you're going
Mhm.
through your education.
Yeah, understanding how the chemistry of the drugs that we provide impacts the individual and the interaction between the drugs, particularly with some of the psych drugs, is a real concern, not only with drug-drug interactions, but also food-drug interactions, right?
Yeah, and we love to use medicines off-label. That's a
Mm-hmm.
thing that psych has a wonderful thing that they love to do. So, um, getting to know the many different ways that we use a single medication is really helpful as well.
Great. Well, Josh, you've done a wonderful job of giving us a perspective of what a typical day for a psychiatric nurse practitioner is about and how one goes about being prepared to function in that role. I suspect that there will be students that will be very anxious to have you in class and look forward to their time in psychiatric nursing with you and the other colleagues here at the School of Nursing. So thank you so much for your time today. We really appreciate it.
Thank you. Thanks for having me.
Well, you're welcome.